Hello, this is Penny Morgan Overgaard, and I'm pleased to introduce you to the Universal Determinants of Health model. Social determinants of health, or SDoH, are the conditions in the environment that affect a wide range of health outcomes, including overall functioning, mental and physical health, and quality of life. They affect health outcomes and they also influence healthcare decision making for individuals and communities. They can be negative or positive, they can lower or raise risk, and they are almost everything that is not genetic. It's important to note that we must have an awareness and understanding of the impact that SDoH have on health and healthcare decision making in order to help individuals and communities achieve their full health potential and in order to balance health equity. The SDoH were developed as part of the Healthy People Initiative to better understand all of the factors that impact health. And traditionally, there are five main domains or categories. Economic stability, that's having a stable, adequate income that allows people to pay for food, housing, and such, and to avoid the stress of not knowing if they will make it through each week or month. Educational access and quality, these are related to opportunities to live healthier and longer lives, but access to education alone is not enough. Rural and low-income areas often do not present the same opportunities or quality of education. Healthcare access and quality, this includes things like insurance coverage, primary care provider access, preventative care and screening. And here again, access alone is not enough. The quality of care counts. Neighborhood and built environments, these are things like sidewalks, housing density versus industry, transportation, proximity and connectivity to services including food, school, healthcare, recreation, and infrastructure. Social and community context is the fifth traditional domain and includes things such as community cohesion, civic participation, discrimination, racism, cultural norms, interpersonal violence, community engagement, and of course, all of these are heavily entwined with health equity and equity overall. As our understanding of the influence of social determinants of health on health outcomes has grown, the addition of structural determinants has been recognized to clarify the role of law and economic and social policies that distribute resources among communities. The effects of climate change have also been mapped as a powerful influence on health that is beyond the capacity of any single government, policy, social system, or even social hierarchy to address in a meaningful or global way. Current models depicting SDoH have failed to account for structural determinants or climate influences. The Universal Determinants of Health is a new model to explore a broader array of the factors that impact health outcomes. This model includes structural determinants of health, which are the socio-political mechanisms that generate and maintain social hierarchies. Here, there is an emphasis on the role of law and in particularly policy in terms of resource distribution. And structural determinants can be used to explore other issues such as war, embargoes, immigration. They also influence stratifications or categories or divisions among groups of people that contribute to inequity. Planetary health, such as climate change, particulates, pollution, and other anthropogenic changes such as chemical spills and water availability and safety, or even evacuation during disasters, all significantly impact the health beyond the capability of a single system to address. Global health equity cannot be achieved without acknowledging the universal nature of health determinants, and the UDoH model formally recognizes social structure and the impact of socio-political issues. It also adds planetary health, which is necessary given the scope of anthropogenic changes and their wide-reaching impact on health outcomes both now and in the future. The UDoH model will aid in fostering a more comprehensive understanding of the intersection of health determinants and health equity and emphasize the global nature of both.